Well, in other health news, do you suffer from eye discomfort? It's estimated more than 8 million Americans complain of scratching, burning, redness, and irritation of their eyes. The FDA has just approved a new drug that could bring relief to those with moderate to severe dry eye problems. Here to discuss the treatment of this problem with us is our friend Dr. Brent Reed from Griffin and Reed Eyecare. Brent, nice to have you back.
Thanks, Walt. It's good to be here.
How common do you run across a dry eye in your practice?
Well, in my practice, I see a fair amount of dry eye. I would guess maybe 1 in 6 to 8 patients that walk through my front door have some degree of dry eye, and probably about 1 in 12 have moderate to severe dry eye, and it really does affect their lifestyle.
Is this something that you're born with, or is it the conditions that you live in?
Both, actually. Some people actually have a lower than normal baseline tear production, which causes them problems, but more often than not it's an environmental issue or it's related to either drugs we take or diseases that we may acquire as we get older.
Now, we mentioned a new drug. What is the new drug?
The new drug is called Restasis. It's actually a cyclosporin-like compound. Cyclosporin's been used to prevent rejection of tissue transplants and organs, similar to what you were just showing on liver transplantation. But cyclosporin will fight the immune factors that seem to cause some dry eye, and it will make those that have an immune-related dry eye much more comfortable.
Are there any other symptoms besides the burning?
Yeah, actually there are. Some patients with dry eye often have blurry vision because they have oil in their tear film, trying to make up for the lack of watery tears. They have kind of a red racing stripe look right through the middle of their eye, and they also sometimes will have problems with variations in vision off and on during different times of the day and night.
Mm-hmm. Now, we have a lot of problems with allergies, living near the Delta and whatnot, and we frequently try to figure out, do we have a cold or do we have an allergy? How can you tell between an allergy and a dry eye?
Sometimes it's difficult, Walt, because a lot of patients have both at the same time. But usually if the eyes itch, if they're very itchy, and or if there's kind of a stringy mucus type discharge from the tear film, that's more common with allergy than with dry eye. Dry eyes tend to consist of symptoms of burning and redness, irritation, blurring of vision. Sometimes overflow of tearing is a symptom of dry eye, interestingly enough.
Any other treatments available, doctor?
Yeah, I believe you showed a graphic a few seconds ago of a plug. Sometimes we'll be able to actually put little drains or little plugs in the tear drains that allow those that have dry eye to maintain a better tear film. Those are a godsend in some people's cases.
We want to remind